Good morning, Dr. Uma. It's a pleasure to have you here on this fireside chat series of Healthcare Frontier. Thank you so much for making yourself available.
Hi, good morning, Chris. It's wonderful to be here and to meet you once again. Thank you for inviting me.
My pleasure. So, this is a very simple 30-minute tops fireside chat series. We want to talk to people such as yourself from the healthcare frontline. How about we start by you telling the viewers a little bit about yourself?
Well, to simply put, I've been in the healthcare industry for nearly 35 years now. I'm a trained neurosurgeon, also a trained healthcare administrator, and have worked in multiple roles. I've been a university teacher in neurosurgery. Then I have been CEO roles in many corporate hospitals in India and also abroad. I've been advisor to the health ministries of some of the African countries, helped design an universal health insurance product for the country level. And also I have a passion for healthcare technology, so work with some of the healthcare technology firms to design some transformative and user-friendly products, which is the need of the hour. And also it is in keeping with the digital health mission of the country. So I feel very good that I'm contributing to that in some way or the other. And I chair the Digital Health India Association in that capacity. And I've recently finished commissioning a 500-bed hospital in Kannur, which is a tier 3 town in India. And, so you never stop learning. So you realize the challenges of setting up that hospital in a tier 3 town versus a tier 1 or a tier 2 city are so different. And this is in Kerala, so the work culture and the labor practices are also so different. So it's been an interesting journey, and one never stops learning. And I'm very active in organizing webinars, forming educative sessions with people, because this is a time when we all are changing. And yes. So my involvement with teaching also continues. So that's another passion. So that is also there. So yes, so that is about me.
Thank you so much. Thank you so much. And I can vouch for that, that every time I speak to you, it's an illuminating exercise. So thank you so much for your time. But since you mentioned Kerala, let's segue that into that first conversation, especially given where we are today. Kerala seems to be seeing a resurgence of sorts in COVID cases, having set the benchmark of how to handle this and things like that in India. Could you tell us a little bit about, what are the reasons behind this surge and what's the insight?
So I want to first tell you that, the surge is, the number of cases reported. My sense is the surge is across the country. The number of cases we are reporting is higher because we test more. We test more, we report more. Okay, so that has been there right from the beginning. And if you see, right from the times when the pandemic started, Maharashtra and Kerala have been ahead in the surge. But that is also true about the number of cases you test. Same is true in Maharashtra. So we are distinct in that capacity. Now, when you say that the number of cases are so much, there are many asymptomatic cases. Not all are symptomatic, not all are seriously ill. So we must understand that
True.
We just don't go by the absolute number. Okay, so that is there.
Sure.
This actually is a reflection that population across the country is homogeneous in its certain practices, and at least our ghettoist tendencies. The way we crowd together for every little thing. So how is it that it is not so in other places where there are so many crowds? And of course it is there. People are not testing enough. So that's one. Number two, what I feel is in the first wave, if you see, we controlled. I mean, there was this whole thing about we did not understand the disease. This was this fear of the unknown, and we had to prevent it from happening. So all focus, if was on preventing it, and Kerala had contained it effectively by very, very strict lockdowns and very strict policing measures, really, for social distancing and masking was like, the police was on the street trying to control people to do all that. So that attempt helped us in controlling the numbers, undoubtedly. But what it also resulted is in less herd immunity now. Now, the phase 1 got over, we all got relaxed, and we started going out like, there is no tomorrow. And lo and behold, the people who are not exposed before are now exposed.
Right.
And then you have the numbers. So we still have probably one of the least numbers in terms of antibody positivity in the population. It is a result of that trying to have an effective control, which in the second wave has come back on us as a double-edged weapon, isn't it?
Understood.
Yeah. So these are, I think, but these are all, what you can surmise. But the fact, yes, that the numbers are increasing, we have to be careful. That is for sure.
And has the vaccination been progressing at a steady clip?
Yes, progressing at a steady step, yes. But, we need to vaccinate far more. And if the numbers are, scary, see, what we have to understand is we all are very mobile population.
Yeah.
So, irrespective of where you are in the country, if any one state is having increased numbers, we need to keep politics aside and vaccinate that set of people more aggressively than the rest. I think, that is the need of the hour. And then we have a festival coming now. Onam will come.
Yeah.
If we want to have, if you don't want to see disaster after Onam or 2 weeks after Onam, this has to be stepped up very aggressively.
Significantly. Yeah. I agree. So, how different has, COVID phase 2 been compared to phase 1 from two perspectives? One, from a medical professional perspective or a medical industry perspective, and the second, from a customer care perspective. How different is it?
So, COVID-1, of course, was a surprise to everyone. So was COVID-2. One would have thought that we should have been prepared for COVID-2. We were not, because we had already let our guard down. There was this whole euphoria of vaccines having been developed and it now being available. People thought vaccine being available means now they are, safe.
Vaccinated.
Unless you are vaccinated and have your 2 doses, you are still not safe. Now that, it's a psychological thing. And people already had that behavioral fatigue after strict policing and strict social distancing and masking. So you wanted to get out of that, it was like becoming free again. So you got hit by the second wave as a shock. Okay. But both of them were shocking enough. In the first, we just didn't know the animal that we were dealing with. In the second wave, we understood far more because the scientific advances in the last 1.5 years for this one disease have been so much. I mean, if you see, for any one disease, has there ever been so much of scientific body of work and literature? No. Has there been so much of global coordination? No. Has any vaccine ever been developed? Not just 150 in the making and 10 in the market. Has it ever been done in 1.5 years' time? No. I mean, so this remarkable scientific advances had already happened by the time we were dealing with COVID-2. So we knew the animal of sorts. We knew what had to be done. But the second wave also saw some mutations. Not unexpected, because every virus has to mutate. So that is something that, and also I know that there is work happening on vaccines against the mutants and all that. So just as the science is advancing rapidly, the virus also is sort of keeping up with what is happening in our world, isn't it?
Yeah.
So the mutant virus was one change that happened. The second was the fact that there were more complications. You also had more younger people. So the thinking that it will only affect the elderly and it will only, be bad for the people who die are those with comorbidities and elderly.
All right. So there was a bit of a bad connection. Sorry to interrupt you, Doctor. Please continue.
No issues. So as I was saying, the second wave saw few different things. The mutant virus was one. We also saw that the elderly are not the only population that are, more thing. You also see the disease in young. The patterns of effectivity are not very different. You get complications in the young as well.
Yeah.
The number of deaths have been lesser,
Mm.
but complications have been high. We
I
saw,
see.
mucormycosis. I mean, everybody saw that. It was because of indiscriminate use of steroids. But in the first wave, and when we really did not know where to do and what to do, we used steroids indiscriminately. Matlab, it was like a jadoo ki pudiya being given to everybody. So it was even given for home use.
Yeah.
Now,
Oh, wow.
but the states like Kerala did not see so much of mucormycosis. Why? Because we did not give steroids at home. Our government was very practical in the treatment that was prescribed, in the COVID protocol here. Whereas you saw in some states in India, COVID protocol included steroids.
I see.
Or even for people who were under home isolation and treatment. So there are these things that we have seen. As far as the behavior of the people is concerned, people have now got used to being asked to do an RT-PCR test. They don't resist. In the first wave, there was a lot of resistance. Why should we do? The resistance was also because it was a stigma of sorts. Somebody is COVID positive, right?
Correct.
So it was like, oh, he is COVID positive, so everybody will sort of isolate that person.
Correct.
Now, stigma is not so much. Discomfort is there. People understand that it is necessary.
Yeah.
So they have started accepting it. So we do RT-PCR for the patients and also the bystanders who have to stay with the patient in the hospital. All of them have to undergo. No questions asked, no fights.
Yeah.
So
it's normal now.
It's now normal. In fact, I think at some point people will, start asking you when you don't test.
Yes.
There is, although in the beginning when the vaccine started, you would have seen that, there is a lot of this WhatsApp university graduates and postgraduates who will, circulate all these rumors, and they have this thing, anti-vaccination and vaccine hesitant groups were there. But I think people are now getting over that vaccine hesitancy. They want vaccination. They realize that it is essential to do your normal day-to-day life. We have seen post-vaccine COVID infections as well, but they are obviously of much lesser less frequency and less intensity. So people understand that it's like any other viral infection. You might still get the disease. You might get the disease from a mutant.
But your ability to deal with it is better.
Your ability to deal with it is much better. I would say you have an additional tool in your armamentarium. Your body understands that, and I think that's a big change that we see. And when prepared for now to expect that there may be a wave 3 and a wave 4, because that's a natural life cycle of these infections, of these pandemics. Every pandemic undergoes
multiple cycles,
waveform. So you have these cyclical waveforms happening till it will come to a base level where your population would have been sufficiently vaccinated. We would have arrived at a balance. There would be we can learn to coexist. Understanding everything about the virus that we need to deal. I mean, like a flu virus. It would become like that.
I was speaking to someone, in one of my previous interviews, actually, Viren Shetty from Narayana Health, and he talked about anecdotally that perhaps in the future, somewhere in the future, there might be 5th, 6th, 7th waves, and COVID would be so common that you'd see a colleague wearing a mask and you'd ask him, "Hey, what's up? You're not feeling well?" He's like, "Yeah, I've got COVID," and it would be okay because you'd have the medicines and so on and so forth.
True, absolutely.
Yeah. So let's switch gears, doctor. Let's talk about the business of healthcare, right? What is the biggest shift that you've seen in the business of healthcare in general, pre-COVID and post-COVID?
The biggest shift, if you ask me, this one change that has happened is use of digital technology. Something which we thought will never happen, or might take years to happen, or patients will not like it, or the doctors will find it difficult, and that whole doctor-patient interface, the physical touch thing, which was so ingrained in our conscience that unless you touch and feel, it will, patients you cannot diagnose. this particular myth got busted big time. And it is both from the doctor's side and from the patient side. Both felt it necessary to not see each other. So it was the necessity of avoiding just one second.
So again, Doctor, over to you. We were talking about how the entire healthcare industry has changed, the biggest shift that you've seen, and you were talking about digital health.
Yeah. So, this shift happened because both the patient and the doctor were afraid to share the same physical space. As I said, we didn't know what animal we were dealing with, and we were scared to be in the presence of the same animal in a closed space. So that was the entire fear that resulted in adoption of digital technology. Because everyone is fierce for their life, isn't it? So you want it was a self-preserving instinct of every human being, and you adopt with what tools you have available. So technology was there. It's been there for so long. It was just not being used. And what better time than this? And then lo and behold, now you have telemedicine being done, commonly, and everybody's open to it. Yeah. So this to me has been the major shift. Now, I will tell you what would be the other advantages that happens because you have adopted digital technology. Yeah. You see, we've been always talking about cost in healthcare. We've been talking about access in healthcare. And without our realizing and making an active effort. See, we've been trying to promote digital actively saying it will improve this. But here, without anyone forcing it for the reason of access or cost, it has happened. And over a period of time, you will find cost of healthcare will come down because the overheads on digital medicine are far less. Yeah. The number of people involved will be much less. You would have lesser specialists who can sit in tier 1 towns and, give care across the entire country or, globally for that matter. Yeah. And it will standardize care. So when that happens, it will reduce cost. And it has already improved access, or at least it has paved the way for improving the access. So the problems that we have been grappling with since, number of years to address these challenges, it's going to get addressed in the future.
Very interesting. And when you say digital health, doctor, you mean everything from, telemedicine, these kind of Zoom consultations to IoT devices and all of those, right?
All of that, which means whether it is remote consultation, remote monitoring, remote evaluation, you also have remote therapeutics, and online pharmacies are going to become popular. So what has to happen is we must not lose this momentum. If there is a carpe diem moment in the, for medical care or healthcare services in India, then this is it. It is now. We need to make, now, so there are many things that have to come in place. The digital related departments or the ministries of information technology, biomedical technology, which deals with devices, Ministry of Pharmaceuticals, which deals with all the pharmacy and devices again, and Health Ministry need to come together. There are many regulations that have to be thought through and thought through fast. You cannot lose this period by being lax in regulation, allowing corruption to step in, and then saying, oh, we can't do anything about it.
Correct. Which is an interesting segue into my next question, which was from your vantage point, if you had to list 3 fundamental changes over the next decade. So let's try and finite time this, right? In the next decade, as a country and as the healthcare industry, what would those 3 fundamental changes be? Needless to say, digital health, since you just mentioned that.
Yeah. So, what will happen is we would have moved from traditional to a very modern way of thinking as far as healthcare is concerned. it will become more personalized. We have wearable technologies now. You will be wearing your diagnostic devices on your t-shirt or implanted under your skin.
Yeah.
Or in your rooms. Okay, you'll have smart homes which have sensors which will be monitoring your blood pressure and temperature and giving an information somewhere.
Yeah.
So if I was living alone in a house, I don't have to worry, if my blood sugars are going up or down, there is a sensor in my body which is giving information to my endocrinologist, sitting in some conference somewhere. Yeah. And he advises on what I have to do, right? So it is going to get into those spaces. It's no longer sci-fi. It is real. It's already happening. It's happening. Yeah. And if, as you would say that, now is the time when you can think like sky is the limit for what you can do. So you would go more into personalized medicine. So the next thing that will happen is there will be a cost arbitration because of technologies being so advanced and the rapid developments making technology cheaper by the day. So you can look at healthcare costs coming down. Now, this can only happen if the industries related around the cost also do their adaptation as quickly as the need is, which is, majorly healthcare insurance industry. If you are paying out of pocket and if you're saving, then whatever mechanisms that one is using, all that needs. But I think the healthcare insurance industry also has to change the way it thinks. Yeah. The traditional thinkers will perish. Or at least they will not, they will be bought out, they will be obsolete, or they will just die. Yeah. So it is necessary. So it is, to me, it is one of the most interesting times to be living in. Yeah. As challenging as it may be, this is also the time where a lot of new business models are coming up.
Models are evolving. True.
Right? True. So as there is a need for new things, new business models will evolve, and the old ones will get replaced or modified. True. So we have to now be open to change.
So from a country perspective, is there, if you were to speak to the government, so to speak, of the states, of the country, and give them your piece of advice on what they should implement over the next 10 years, hypothetically, what would you tell them?
One is far more investment in innovation and research.
Yeah.
Which we have brilliant minds in India.
Yeah.
I sit on the evaluation panel of many of these digital health devices and solutions and softwares. And you have to see some of them to really, be amazed. But they don't see the light of the day because we do not have the rest of the paraphernalia to support them.
Yeah.
In time to come to the market. Yeah. Because a product can otherwise sit on the bench for years. And it happens routinely in our country. I think our government needs to shift the way it educates its people and also focuses on innovation and research. That's major. Okay. Secondly, we need to rethink our conventional model of healthcare. Which we have built around the brick and mortar infrastructure, your primary healthcare centers and the community centers and the bigger hospitals and the medical colleges. Yeah. While these structures were the need of the hour, 70, 80 years ago, we need to adapt to the newer changes. Today's PHC is a health at the doorstep using a tablet.
Yeah. Yeah.
That tablet and the ASHA worker alone works as a primary healthcare center.
Yeah. Yeah.
Okay.
So true.
So rethink, merge the two and get the best out of it.
Yeah. Yeah. So true. Since you mentioned the tablet thing, a thought just came to my mind. I think it was in the late 80s or early 90s. There was a Steven Spielberg produced film or directed film called Inner Space, where it was about miniaturizing a person in a particular device and he went into the bloodstream of the person, and he basically went inside the body and navigated. And in a way, that sci-fi today is real, right? In the form of the capsule that kind of goes in and sends signals back.
Yeah. So as you really say, I mean, when you say that, okay, you want to blue sky this whole thought on how
Yeah.
far that we can go, you would not be surprised if in our lifetimes, or at least surely I think that will happen, is that you will have a holographic image of a doctor or a patient being transported, teleported to another site, multiple teams of doctors looking at one holographic image of a patient with all sensing abilities. Today, the holographic images are probably just visual, right?
Visual, yeah, yeah.
Yeah, well, it will have other sensory
Brilliant.
modalities integrated into it, and you could probably do that. I mean, I'm just,
Yeah,
thinking
yeah.
of what are the possibilities. I actually think that this is a possibility which
Wow.
I will live to see before I die. I
Brilliant,
am
brilliant.
quite certain of.
That's a fantastic piece there.
I mean,
So,
I'm putting my pennies on this happening.
yeah, I mean that'd be an amazing thing to see in our lifetimes, right? So let's switch this to the brutal reality of the Indian healthcare system, right? And put the patient at the center of that universe, right? So, what, according to you, or in your opinion or experience, are the biggest fears of an Indian when looking for healthcare? Let me give you a few options. Number one, choice of finding the best doctor. Number two, choice of finding the best or appropriate hospital. Number three, the right advice, about their healthcare options. And number four, lack of insurance or inadequate insurance, and hence their inability to pay for healthcare. So, what, according to you, between those four, are top of mind for them?
The top of the mind when a person falls ill
Yeah.
is the cost.
Wow.
As a cost. There is a significant number of people in our country who actually get pushed below the poverty line because of healthcare expenses.
Yeah.
There's a large number. Okay. Because healthcare largely remains an out-of-pocket expense in our country. The penetration of healthcare insurance is very low. It is, okay, in the corporate world, it is there.
Yeah.
But at an individual level, at an urban rural level, semi-urban and rural level, it is very, very low. In a society like Kerala, I mean, I stay here, the number of people with health insurance is so less because it is a classical method of just paying out of pocket. Nobody's thought beyond it. I still find such people. So, and when illness comes, the first thing is, who will pay for it? How will I pay for it? How much will the expense be? That's a fear. See, finding the best hospital, finding the best doctor are not so much of an issue now.
Yeah.
You can find them. You may not find the best, you will still find the second best.
Yeah.
But if you don't have the money to pay for your treatment,
Pay for it.
what's the best doctor and best hospital worth?
Correct. And do you see that as continuing to be a dominant problem, the out-of-pocket expenditure on healthcare piece in India?
Yes.
Yeah.
Yes. Until, see, we know that health insurance came to India in the early 80s, 81, 82, if I'm right, somewhere around then is when health insurance was introduced in India. Now, from there till now, and it's been 40 years, why is it that we are still not seeing so much of popularity of health insurance products? Obviously, it's not meeting the expectations of the people. There is something which is missing. If the product is not appropriate to what the people need, you cannot push them to buy it.
So true.
So we need to really do some soul searching here and see how best can we meet the needs of the people. See, we have to not meet the needs of the healthcare insurance business. We have to meet the needs of the people.
Absolutely right.
So let's design an insurance product, not for the insurance company, but for the people.
Absolutely right.
So if that, the comfort, the fear, the lack of fear,
Yes, doctor.
So as I was saying, that people have the fear of falling ill, not because they think that they will not be cured or they will not find the right doctor or they will not find the right hospital. They have the fear of losing all their savings.
Yes. Single biggest reason for Indians to fall below the poverty line.
And beyond. And beyond.
Wow. Wow.
So the uncertainty around it.
Sure. Sure. I was just going to say, Doctor, that, I've heard of stories in Kerala of, the financing counters from Manappuram Gold Loan Finance to Bajaj Finance, etc., being placed in the hospitals, right? So what is your experience around that?
So that is true. Okay. So I know that even in our hospital, we have a Bajaj Finance counter. So, so from the hospital's point of view, it makes business sense to have them because you're sure that the patient will pay you before the patient leaves the hospital. Right? Now let's look at it from the patient's point of view. Not having talked to people directly, because obviously in the role that I have in the hospitals, I can't ask them if it's good for you or bad for you.
Yeah.
So I have to be sensitive about that. But if I were to imagine myself in that place, if I was a patient and I didn't have enough money, or the relative of a patient and I didn't have enough money, what would prompt me to sign up for something like that? Because of my desperation. And the fact that I do not want to be embarrassed in the hospital by not paying the dues.
Yes, doctor.
Yeah. So, although as a professional in the hospital, and in the hospital you have to you give in to having all these counters and things like that because you want the patients to pay up before they leave. That's normal business. But so if I were to put myself in the shoes of that patient or the patient's relative, and I saw myself in front of the billing counter and not having money to pay, a couple of emotions that will cross my mind. One is I also know that I don't have money back home, so I don't have immediate finances. I do not want to embarrass myself by asking people and be refused loans. I also do not want to embarrass myself by not paying the hospital bill and going without knowing when I will pay them back. So what would I do? I'll take this easy option that has come, that it meets my immediate need. कि कल की कल देखेंगे, अभी तो निपट जा. Just do this. So I will take this loan. Now, in the best of times, that you and I don't read between the dotted lines, between the lines before we sign up something like this. In all the insurance policies and everything. Why are people so hesitant? Because there are just so many clauses which you don't understand. And when you take something like this, which you are not sure of the transparency, you are in a troubled state of mind, you will not understand what the person is trying to explain to you. So at this time, you will take this. And later on, you will realize that it is still difficult, you have to still pay it back, right?
Pay it back.
So you don't know the terms, you don't know the terms, you don't know all that. So that's an issue.
And those interest rates are not cheap, right?
Those interest rates are not cheap. You have to repay. Somebody may come home because you've not paid your EMIs on time. You get into that cycle where you are troubled all the time. Isn't it? You have a very heavy load to carry.
True. Big problem.
You have a feeling of guilt. So you have a feeling of guilt that you've troubled your family for a long time, but you also, as you getting into a situation.
True. So, on a final note, doctor, if you were to go back to your blue sky and talk about top 3 things on the top of your mind over the next, let's say, 5 years, not a decade, but 5 years, across industry, across let's say insurance and out of pocket in that bit, and government, what would those three things be?
So the first thing that you have to address, and especially now, even because there's also a financial recession globally, things are, so many of us have, lost jobs, so many of us have lost businesses. Many traditional businesses have died out.
Yeah.
And people who made big malls are now wondering what they should have done with it. Or maybe the neighboring China store would have been a much better model, isn't it? So in a world which is as uncertain as this, few things that will not change is your requirement for healthcare will increase. Because we are also now going to add a huge load of, burden of mental health on the population.
Yes.
Stresses and all that, which we never saw before. The comfort, we are all no longer, comfortable.
True.
We live in a period of uncertainty, all of us. So in this period, we have to seriously consider addressing the issue of cost of healthcare.
Cost of healthcare. Yeah. Cost of healthcare, you said. So, doctor, you mentioned cost of healthcare being the one important.
So the number one thing for me would be that we have to address the cost of healthcare.
Yeah.
Second thing, we have to redesign the infrastructure for the new normal. Okay. The earlier done, the better it is. Now, you would hear a lot of people saying, oh, I hope that all this will end and we'll go back to a pre-COVID days. Now, I want to tell all of those people that that is not happening.
Yeah, it's not happening.
There is not going to be a pre-COVID era again at all. We will not be living like that.
Yeah.
Consider it, evolutionary in an aspect.
Yeah.
We had a whole lot of technology and tools available to us, which we never used. And I think nature wanted us to use them. So it's evolutionary, forceful usage of those tools.
Yeah.
And people say that your solution is already there before a problem comes.
Yeah.
So we had part of the solutions. We had the scientists with this brilliant mind. We had, brilliant communication between people. We had global connectivity.
Yeah.
Whole world was a small place. So just as virus spread because the whole world was a small place, the collaboration to manage that also happened because the world is a small place.
Precisely.
Isn't it?
Precisely.
So, I mean, I always say that the solution is always there before a problem comes. We just need to be ready to get it. So that is not going to happen. We are not going to socialize the way we did before. Look at the way we seek healthcare now, it is different. Look at the way we do education now, it's different. The whole scenario has, look at the way our travel industry is going to shift.
Yes.
The airline industry has lost all its business. It has to re-engineer business, and we have to do new modes of transport.
Yeah.
We probably have teleporting in a capsule across wherever you want to go, or design the public transport spaces. So all that will happen. Similarly, for healthcare, you need to change the way the healthcare infrastructure is. You perhaps have to permanently have a space which has a separate entrance and an exit for various different viral ailments that will keep coming.
Yeah,
See,
true.
In the last few years, we've seen H1N1, we've seen HIV, we've seen, all the bird flus that happen, and now this pandemic. So, then every now and then there will be, some infections like this, which will be happening. That's nature for us.
Yes.
We need to learn to deal with it. So we have to be prepared to adapt to the newer technologies and to be open to innovations, and the governments need to make spaces for all that and encourage those spaces, because otherwise those who don't will perish, isn't it?
Yes, absolutely.
So we need to look forward to that, look forward to changing ourselves, to brace ourselves to this new model that will evolve. So I'm quite optimistic about, living in even these challenging times, to say that a better world will emerge. See, why will a
Brilliant.
better world emerge? Because we also understand more about human values, which we were losing.
Yes.
In the COVID world, we were more self-centered.
Yes.
Okay. Today, we are not as self-centered. We are more isolationist, but that is different from being self-centered. We
Absolutely.
are isolationist because that is protective. That is
Correct.
self-preservance.
Brilliant.
So,
Brilliant.
we need to be ready for that world.
So, on that note, and on the note that a better world will emerge, I want to thank you, Doctor, for spending this time with me.
Thank you. Thank
Thank
you.
you so much for your insights.
Thank you. Yeah.
Yeah,
Yeah.
it was
Thank
always a
you very
pleasure.
much.
Yeah. Thank you, Doctor.
My pleasure too. Yeah. I enjoyed myself.